Great song. Thank you, Scott and AV team, for playing that. So while they take their family photo, I'm going to welcome Ian and Joel to the stage because we're a little over time, so I want to get back on track. So thank you, ladies. Thank you so much. Thank you. And thank you all for joining us this morning. I know that there were some dinners that took place last night, so I appreciate you waking up and being back here. We have another great day of programming. We're going to move into the next session here with Joel Krikston of Merck and then Ian Goldstein, partner of Fenwick, to continue on with the topic of M&A and where companies can be landing right now with their exit strategy. So Ian, I'm going to turn the stage to you.
Thanks, Christina. Good morning, everyone. Happy Thursday, or something like that. Anyway, excited to have this conversation with Joel Krikston, who's a managing director of MSD. That's Merck in the U.S. and MSD worldwide. Is that
correct?
Right?
That is correct.
Okay, fantastic. I've had the good fortune of working with Joel and the team at GHI for the better part of 15 years.
Amazing, yeah.
So tell us a little bit of, let's go to your origin story. Right? Where were you before MSD and GHI, and how did you become part of the team?
Yeah, great to be here. Thank you for having me. So, from Pittsburgh, originally the son of a Catholic school teacher and a social worker, so a very natural, obvious path to corporate venture capital. Went to NYU and spent a bunch of time in investment banking, about 7 or 8 years, and came out of that banking experience thankful for the diversity, I think, learning how to look at different types of transactions, think about a company's strategy, approach through the financial statements, et cetera. But really, in that process, had the opportunity to work on some IPOs back in the heyday of the genomics and internet bubble back around 1999, 2000, 2002. And interacting with entrepreneurs was just intoxicating to me. Seeing it, and it was amazing to hear Mike speak this morning. I think being in a big corporate environment, but then sourcing that energy from these people who had this vision and this passion to change the world really turned, I think, the lights on for me that I wanted to find a way to be able to interact on a daily basis through my work with those types of organizations. So I left the banking world in 2006, went over to J&J, spent a little bit of time doing business development for them, and then joined their venture capital group. I guess that's around 2009. And during that period of time was really working on areas where J&J didn't necessarily have an organized business. So we would call it white space back then, things like regenerative medicine, neuromodulation, and one of those areas was digital health. There was a lot of things happening in the digital health world in terms of the digitization of electronic data. Everyone had a mobile device. Clinicians were starting to change the way they were interacting with that information in different types of workflows. And it felt like the kind of place to put down my little shingle in the venture group and say, this is the place I could perhaps be a subject matter expert. There's lots of PhDs running around doing biotech deals and medtech deals. That's not necessarily my background. So I, of course, dove in both feet, and 6 months later, the head of the J&J venture unit turned into the head of pharma R&D, and he wasn't interested in anything that wasn't a molecule. So, as usual in my life, perfect timing, like getting in the wrong lane that immediately slows down. But still did that for about 2 or 3 years, trying to build that practice at JGDC, and then in 2013 left, and was really fortunate to join the team at the MSD Global Health Innovation Fund. I had been watching them from afar, and was sort of stunned that this big entity, MSD, Merck, which is really famous for not invented here syndrome, was doing all this experimentation with digital health. Their group was leading some really interesting deals, and I had the opportunity to meet Bill Taranto and Dave Stevenson, David Rubin, Joe Volpe, some of the folks who really started that fund. And it was exciting to me to think about a lot of the ideas I had in terms of the role for big pharma in thinking about what was happening with digital assets, thinking about what was happening with the way we interact with our patients, with our customers, is fundamentally changing. To be able to go do that on a platform like MSD had, with a significant capital commitment from MSD to explore that area, was too good to pass up. So 14 years later now, here I am, really thankful. We have an amazing team of folks. We've really started to build out our platform. Susie Oblock is here, who is one of our most recent additions, really trying to help us drive the strategic value story for MSD. How are our portfolio companies supporting MSD teams? I think we'll talk about that today. Our approach is a little different, perhaps, than many CVCs. But if I look at the group now, maybe just a few numbers, we've got about a $600 million commitment from MSD, which is a big commitment in an evergreen structure. We have investments all over the world, different constructs of early stage investing through both our Merck Digital Sciences Studios, which support our R&D organization, as well as our MSD Idea Studios, which I look after in Singapore and in Berlin, which are trying to help our business units outside the US really tap into the power of the fund. We have about 60 plus portfolio companies, almost 70 partnerships now between our portfolio companies and MSD teams, which is our pipeline to show strategic value. And of course, if any of you got to see Bill and get a little bit of a recognition yesterday, Bill's vision for this thing 16 years ago is now still running very strong. So I feel very fortunate to be a part of this group and obviously work in this industry, but it's been a great ride.
Yeah. So I want to dive in on the strategy side specifically before we get into the partnerships, because I'm fascinated by both. Merck at its core, MSD at its core is a science company.
Correct.
But yet the strategy of MSD GHI is not core to science. It's sort of technology and data and sort of the ecosystem. So talk to us about that strategy. How did it evolve to where it is today, and how do you think about that, given sort of MSD's core business?
Yeah, it's sort of a funny proposition, right? You create a venture fund to not invest in the core product of the company. Mm-hmm. And MSD does have a venture fund, of course, that is investing in early stage biotech, different types of modalities, new science, new therapies, vaccines for our patients and for our customers. But I think this was part of Bill's vision, which is why in an ecosystem as complicated as healthcare, do we have to sit passively and hope that all of these other variables and codependencies that ultimately impact our patients' access to medicines, our ability to generate evidence in support of our products, our ability to secure our supply chain, our ability to increase the speed and pace at which we both find patients as well as discover new medicines, why do we have to sit passively as a part of that process? So can GHI be a catalyst that goes out into the world and says, let's start having an impact to shape the ecosystem that we exist within? And the beauty of that is that we release ourselves from being in a competitive situation with many of our peers, and in fact today co-invest with just about every other pharmaceutical company that you can imagine. It's a space where we're almost utility building together, because these are utilities that are super important for our industry. But it also gives us this freedom to start really thinking about, and I was thinking about something that the group yesterday morning was talking about, sort of thesis driven. Mm-hmm. What are we seeing change in the ecosystem where we can get out in front of the business and hopefully start to shape that, educate our internal leaders, create this feedback loop of experimentation to say, this is an emerging technology. Perhaps you don't know what we should do with this yet. Mm-hmm. But let's try and avoid the natural inclination to build everything ourselves, right? Let's use venture capital as a business development tool to go out, partner with those early stage companies, run some experiments through Susie's operation to actually generate real evidence that says we should do more of this, we should do less of this. This truly will be a core competency in the future. Perhaps this is best left to a vendor relationship, or let's move on. I think that's the magic of GHI. It takes a lot of educating internally because there's always this natural draw to build and to empire build and to hold resources. But we can amplify the effort of MSD leaders and business teams because we can leverage other people's capital, right? We can become part of syndicates where we don't have to fund the complete build out of every capability that we have a dependency on. Mm-hmm. I think the challenge for that, which is a little bit of the theme, I think, of our conversation, is when you're not investing with M&A as the ultimate outcome. In fact, M&A is almost not going to be the outcome for everything we do. Maybe some of the early stage science adjacency things we do. How do you show strategic value? It's not going to be because we de-risked a preclinical asset and MSD bought it in phase 1. And that's, I think, where we've spent a lot of time over the last couple of years really developing this playbook around strategic value creation, where we can go back to these business leaders and say, this is how we made your health outcomes research team far more efficient and productive with AI that's generating evidence at a pace we've never seen before. Here's how we found more early stage lung cancer patients that would benefit from our products, but are very difficult to find in the everyday workflows of healthcare. Now, here's how we can support patients with education tools, or If you go outside the US, we're building women's health clinics in the Philippines because women in the Philippines have a very difficult time receiving a judgment-free consult from a clinician on anything besides maternal health. We have a vaccine that prevents cervical cancer. We think we have a role in terms of creating infrastructure to help those women get to that vaccine, right? So the fun part of our job is we have this really wide remit to go out across this hugely complicated thing called healthcare and try and shape it, not just for MSD, but really the classic sort of rising tide lifts all boats. But we've got to figure out the strategic value piece. It's not philanthropy, right? We have to show the results.
Yeah, so let's talk about that, because just about everyone in the room has a remit to bring strategic value back to the parent and to their portfolio companies. And you mentioned earlier that I think you have over 60 partnerships between MSD and your portfolio companies. So talk to us about, like, how did you build that, right, to a level of scale and success? Because again, that's something that I think every CVC is challenged by. Like, how do we actually do this, especially when it's a little bit difficult to bring the core business units along that journey if that's not like necessarily obvious that those connections bring value. So talk to us a little bit about that.
Yeah, I love that. We did something about 7 or 8 years ago, and we launched a strategy that we call enterprise coverage. And the idea was the thesis building part's super important. Mm-hmm. But I think historically we would do a lot of investing where we were confident in the quality of the asset and where healthcare was going, and then sort of run through the halls of MSD with our trench coats open saying, here's our portfolio companies, would you like to work with them? Mm-hmm. We tried to turn that on its head a little bit to say, let's give each investor a very specific remit in the group to have an internal MSD customer. Mm-hmm. And your job is to essentially infiltrate everything they're working on. Get into their work streams, go find out what their strategic priorities are, figure out who the real decision makers are, where are their budgets, what groups should we be a part of? Even if the solution is never a venture investment, we've got to get into these rooms earlier. Mm. That was really the way to show this, the center of excellence everybody hopes for, where they name it the center of excellence before they ever demonstrate any value. We sort of took the opposite approach. Let's go show value. And the guess is that our phone will start ringing with inbound calls, and that's exactly what happened. So each investor now spends a lot of time internally really prioritizing the voice of the MSD customer, thinking about areas where external innovation could likely be the solution to a challenge we face in our business. And then what we try and do is bring our thesis piece to that equation, right? It's almost like a translational role. I always think about, in biology, somebody discovers something in a laboratory, but you've got to figure out how that mechanism of action impacts disease somewhere. It's sort of what I think we do. We look at the external innovation landscape. We don't ask them to define the kind of company that would solve their problem. We just want to understand the problem. Mm-hmm. This process takes too long. Or, I want to run a new campaign that's hyper-personalized through an agency, but I can only get output once every 6 months. Or fill in the blank. You can imagine across a 70,000 person biopharmaceutical company, there's no shortage of use cases. But that translational role that we play as investors to say, thank you for letting us in the room, we're going to go out and bring in what we think are best-in-class solutions to that sort of a problem. And we're going to help you form partnerships. We're going to work through Susie's group, coaching those portfolio companies up so that they're not doing a dog and pony show of everything they could possibly do. We're actually having them come in and present to you that's very, very specific to your use case, right? Bill had the vision about 4 or 5 years ago to say, let's create a side bucket of money in the fund, which is non-dilutive, non-equity dollars, so that we could actually go out to those MSD stakeholders and say, we'll help fund your first experiment. Mm-hmm. And not surprisingly, when you walk around with a bucket of money, you make friends relatively quickly. So that program has been very successful. We have about a 75% conversion rate on those early pilots turning into more scaled relationships. And then we take that feedback and we take that evidence back to those business leaders and we say, this is what it looks like when you experiment with these kinds of technologies. And of course, as you can think, the CFO loves this. It's sort of a self-funding process, right? We partner with the entrepreneurs and the startups. That's good for them. They would love to have MSD as a customer. As a venture investor and as a participant on their cap table, as we create value together, we're capturing some of the value we create through our equity investments. So we don't need any goofy revenue shares or royalty or suffocating agreements with our portfolio companies. Someday they will exit, We'll get a financial return, which probably pays for whatever MSD ever spent as a commercial partner. The utility now exists in the world. The strategic value from the existence of that utility is flowing through our business and others, but most importantly, helping our patients, aligning with our mission to get these medicines and vaccines out to the public. And we didn't spend $100 million building every single capability that's relevant to our business. I think that's why you've seen our group grow in terms of the capital that's been made available to us from the CFO, because it's a really nimble but thoughtful way of actually operating as a cost center, but bringing all of that external innovation into the business.
Right. It's a very clear way to articulate strategic value internally and to portfolio companies. How do you, looking outward to building those portfolio companies to scale, how do you think about that in partnership with others, right? You mentioned sort of like working with others, collaborating, getting leverage outside of MSD's dollars. So how do you think about that, and what are those needs in particular in healthcare?
I think the really lovely part of where we invest is that it's incredibly, from a peer-to-peer perspective, very, very collaborative. We are still financially aligned around this as an investment. This is not a consortium. This is not some philanthropic approach. So the beauty to me of a startup is that it brings all of that to a very linear place for the people who want to support the growth of that startup. We spend a lot of time leading now with our playbook on strategic partnering. In fact, we're chasing a very hot deal at the moment where I met the company, and the second meeting was with our platform team to go out and walk that company through exactly how we approach this almost concierge service through the organization. It's not a guarantee of a partnership, but Susie's approach through sort of this account management philosophy. We're going to look at MSD as a whole. We're going to think about your set of capabilities. We're going to organize the buyers in terms of priority. We're going to think about almost your TAM inside our organization. And then we're going to roadmap with you how we go into each one of those conversations, who the key decision makers are, when the timing is right, when you've built up a certain amount of evidence. And then what I'm finding, and I think Nicholas said this yesterday, which I thought was great, and we all know this, it's not hard to write venture capital checks. It's really hard to write venture capital checks into the companies who don't need your money or who have a lot of options. And we're now finding that we are being offered up the one, perhaps, strategic pharma slot in highly competitive syndicates, which I think is something we're very proud of. Right? Those are the phone calls you want to get. Those, whether it's coming from sort of more traditional purist financial VCs or from the entrepreneurs themselves, they realize that we take the strategic value side very, very seriously. It's not, we'll deliver MSD to you, which I think a lot of corporates might say, and then you kind of go through and you have a couple of meetings and it's exciting and everybody gets together and then everybody separates and nothing ever happens, right? We've spent a lot of time doing that. Seeing that we have a very crystallized approach and process to helping you make your way through this thing called MSD has been really powerful for us. And many times, we share. I think one of the things we love about GCV is we get to come into a room and think about how are you doing it. We're a part of a couple of other organizations where we also ask those types of questions. So sharing best practices, which you would never do if I was trying to get a biotech asset from you and we were competitors within the industry, right? So I hope that answers your question. But yeah, I think we really look forward. In fact, when we lead deals, we'll oftentimes invite other strategics in with us.
Yeah, fantastic. We're out of time, and Christina wants us to keep on time. So it's a great conversation with Joel. Thank you. Very
great
insightful.
Seeing you. Yeah, great to be with everybody.
And I'm excited to see what the future brings for MSD.
Cool.
All right.
Thanks, everybody. We're about to say hi.